I just want to kind of set the tone, right? So I'm going to start with you, Paul. Maple City has built a real reputation for strong screening rates. You guys have one of the highest screening rates. It's over 70%. We'd love to see it. We'd love to hear it. So, from a leadership lens, what foundational shift at your clinic made screenings feel less like a checkbox and more like a shared responsibility across your team?
Yeah, no, great question. We're very proud. We have the number one cervical cancer screening rate in Indiana of FQHCs and number 3 for breast cancer. And I think it comes from having this idea that we are in a long-term relationship with our patients. We're not like our core of who we are and what we do is really built around being that medical home, that place where we can build trust and build relationships, and where we are caring about that patient, not just to address the urgent issue that brought them in today, but we're really thinking long term with them. And so having your staff aligned around those objectives, which means putting a little less emphasis on exactly how quick was that appointment, on exactly how many billables did you do in that appointment, because it could be that it takes a couple appointments with someone to build enough relationship where they're going to prioritize something like this that may be invasive. It may have a cost if it's mammography in the community, things like that. And so really just that emphasis around long-term care for the patient, and that we're really trying to set a standard of quality that you would want for your own family. So we encourage all our staff to be patients. Our donors we encourage to be patients, our board members, of course, to be patients, because if it wouldn't be good enough for me, for my family, then we shouldn't be doing that for our community. And so really trying to set that standard from a staff mindset perspective, I think it's been really important.
I love to hear that. There's so many times where I feel, my cousin, she works in healthcare, she's a nurse, and there's points where she's, been honest with me, and she's like, sometimes I just have to desensitize myself and like not even think about it from a patient's perspective. So I'm glad that you're putting that experience first. Like, is this care good enough if this care is not good enough for us, what makes us think it's going to be good enough for others? So I appreciate you touching on that. My next question is going to be for Heather. Um, Speaking about mobile vans and mammograms, your outreach has been amazing. Last time we connected with you guys in March, you said that 20 out of 20 appointments were fulfilled. So can you just walk us through what that looked like in practice, and what surprised you most about the patient response for this?
So for us, we get the mobile mammogram unit from U of M in Ann Arbor, Michigan, and they come down here, and we have a lot of patients that don't like to get their mammogram done. So one of the things was that we were like, we need to find something to come to the patients, come to us, where they feel comfortable to get it done. So we did a lot of research, got UMM out here, and we got 20 out of 20 ladies to come and do it last year. Some of the things that we did to reach those patients were we did advertisement in our newsletters, our Facebook. We had it posted in our clinic. We had the providers spread the word. Our referral specialists, if there was somebody scheduled for a mammogram or an order placed for a mammogram, they would offer them doing it in the mobile unit. We use Care Message as far as a texting platform to use, though, to send a message out to those patients that were due, and then communicate back and forth that way. We also have one coming in May, May 19th, actually, this year, and that one is full with another 20. And we have used the same steps there, using Care Message, clinic, providers, getting that word out as well. And then we have one in October, and we already have 13 ladies on that schedule. So it's been a huge success.
That's amazing. Shameless plug on our end. Look at people using our platform for the right reasons, and making that, not for the right reasons. Obviously, everyone here is using it for the right reasons, but just to push that engagement out there and that outreach. Thank you for using us. We really appreciate it.
But that's been huge because it's just like I wasn't full 3 days ago. I wasn't full for this May, and I sent another reminder out, and I had 8 slots open, and I filled all 8 of those by simply sending a text. Because it's on people's minds that they got to do it, but they forget to schedule and do it.
Yeah.
So they need a constant reminder.
They do, right? And from, from a marketing perspective, people always say you got to market your thing 7 times in a row for people to really like understand it and make that click. So again, appreciate you. Stephanie, I'm going to move on to a question for you. The Charles Drew mobile 3D mammogram van has become a signature way for you to reach women who might not otherwise walk through a clinic door. So can you talk about a typical day on the van and like how it looks like, and how did you land on 3D as the right technology for your community?
Absolutely. So we actually are the mobile that we use is through Nebraska Methodist Health System. They are actually the only mobile mammogram in our state. So they stay extremely busy. Nebraska is rather large. So we actually have them out here once a month, and I could almost have Heather repeat pretty much everything she said about how we manage our outreach. We do. I say we. I am the person who handles all of our cancer screenings. So we do the calls, we do the care message, text messages, we advertise on social media. We utilize we have a marquee outside. Like, we're constantly putting the word out there that we have this available. And every single screening mammogram that comes through, the first option that we provide is the mobile, because it's right here in our neighborhood. It's available whether or not patients are insured. We have It provides better access. And what the reason it is 3D, as we all well know, 3D mammograms are a more complete option. It catches a lot more than a 2D mammogram. It is better for those who have dense breast tissue. It's overall better than the simpler 2D. And because it can catch more, even smaller things, we're able to then schedule diagnostics after the fact with Methodist and still manage that care and coverage in various ways too.
Yeah, no, I appreciate that. And also one of the things that you and Heather both mentioned, just like posting on social media.
Mhm.
Um, I know that like there's clinics and organizations out there that almost feel defeated and they say, we're not getting enough likes or engagement on it or whatever. But at the end of the day, like, so what if you get 2 likes on a post? Like, people are still seeing it just because they're not clicking on it or whatever the case, right? And they will still make that effort if that means going on the website on the side or whatever the case, right? So I just want to keep encouraging folks on here today, like, use social media. Like, please, like, keep posting it, even if you think it's not working. It is, I promise you. I'm gonna move on to Paul. We're gonna talk about playbooks here, right? Because the three of you are on here for a reason. Your playbooks are amazing. Everything you do, the steps you take to do this for our communities. So, Paul, your team has shifted from asking patients if they want a screening to presuming that it's just a standard part of every visit. So, how much of your, 70+% of success do you credit that mind shift, and how did you bring your providers along with it?
Yeah, so we've done a lot of things to get those numbers, and one thing I'm really proud of is that even though we're doing well in the state, we continue to improve. So in both cervical and breast cancer, we've improved by like another 2 to 3% in each of those over the last year. So it keeps coming up. And yeah, I think part of it is around outreach. And so yeah, social media is great, but also knowing your community. And so like in our community, particularly our Hispanic patients, like radio is the best method for getting to them on the Spanish language radio. And so we've been able to engage that. We get even more connection that way than social media, for example. Um, Part of it is leveraging technology to make it the easy choice for people rather than not. So historically, we relied a lot on sort of manual telephone call process, someone who is doing a lot of scrubbing the lists. And so when we did that, when we had 6,000 patients and now we have 12,000, and we've been able to keep just the same amount of staff doing it by now having care message in this case as the tool that we're able to like leverage that up. So how do we act smart there? And then building it into the clinic structure as sort of the workflow that they're working through, and giving providers, I mean, I think this is the key. You have to have enough flex in their day that they can add on some of these things. Because like if you're going to add a PAP, it's not this, like it's no longer a 15-minute appointment, right? Like you're going to have to add some more time there. So either you have to set up your structure that you're going to be able to get that person in very quickly again, but then they're going to have to take another day off work. They're going to have to find transportation. Like, can we create structures in our clinic day so that when the person is at the right mindset, they're ready to do it, they've heard it on the radio, they got the cue from care message, they're there, would they add it on to their appointment? And can we just take care of it right then? But you have to have the whole team sort of aligned and built around these objectives.
I totally agree, right? Like if everyone's not on the same page, things aren't going to work. So, Heather, when someone walks in who hasn't had a PAP or mammogram in 5 or more years, there's often like just a layer of fear or like avoidance. So what small human moments have you seen make the biggest difference in easing that anxiety?
So a lot of it is them feeling comfortable with who they are talking to or who is in the room when something is happening. So, for example, like with our providers, when we have somebody come in for a PAP, there's always somebody else, another MA in the room with that. We let the patients, we give them an option. Like, is there somebody else that they feel comfortable being in the room as far as like an MA? Do you have a favorite, like an MA that you like that you want to be in? Mammograms we are doing where during the mobile unit, I am out there sitting next to the mobile unit underneath the tent, rain, shine, snow, whatever, waiting for those ladies to come so that I can help them get up the stairs, get in there, make sure that they're comfortable. If they have any questions, I can assist with those questions. Or if they're going to a hospital or something, we have available our transportation to take them, or that I can take them to get them there. Having that person that they know and feel comfortable with to go with them or to be with them is huge.
I totally agree. I feel like those small things can make such a big difference, right? Just having someone there. And Paul, I saw you initially shaking your head like and nodding and agreeing. Did you have anything to add to that, especially when she was mentioning like having someone in the room that you feel comfortable with or whatever the case?
Yeah, it's just so important to have staff, and it's from the providers to the front office person to the person making the phone call. Like, the more they can identify with them, like the better that's going to be. So making sure we're hiring people at all levels that come from the communities we're trying to serve, and then being really like thoughtful, listening about who they want to be seen by. So, one of the reasons we have some people have come to us rather than a local hospital is one of the local hospitals did not want to accommodate if they said, like, I don't want a man anywhere involved in this process. And they're like, well, that's the staff we've got. And we want to be like bend over backwards if we can to accommodate patients. Just exactly what Heather was saying. They've got to feel comfortable. Otherwise they're going to say no.
I totally agree. Yeah, no, I mean, there's been plenty of times where I'm sure that a lot of people in this event have felt that. So, um, Stephanie, question for you. So, outreach is one thing, but follow through is a whole different story and approach. So, what does your outreach playbook look like when making sure women actually make it to the appointment once it's on the books, especially for patients who have canceled or had a no-show before?
So I like to call myself friendly aggressive. Um, so when I do not come from any sort of corporate background. I am very much myself when I'm talking to patients, which I have noticed makes them a little more comfortable that I can provide education that is culturally sound. It doesn't seem clinical. I give them the facts. I let them know exactly what's going to happen. With people who are hesitant, I've had a number of patients who have canceled many times before. And when I finally do get them on the phone, it becomes less of an education conversation and more of a what's going on conversation. Is it transportation? Is it you're not sure about the process? Is it, what is it that's keeping you from getting here, from getting these screenings done? And once I know what that answer is, then we can actually address it to get them on the mobile, to get them in the clinic, to connect with what their why is or what their why not is, to understanding why they should instead. There is still, sometimes they come in, but they still pretty reluctant. And it just being there personally, sometimes I even just go into the lobby when they're checking in just to make sure that they're okay, that that I appreciate their follow up and their connection to their own healthcare, and talking about their own advocacy in um, getting their care in the first place. So it's a lot about connection. It's 100% about connection, in my opinion, and in my role, because if they can't connect with the purpose of what they're doing, then they're not going to follow through in the first place.
Yeah, I totally agree with that. And this whole entire event, that's been the common theme, right? Rebuilding and establishing that connection. And then just a follow-up question to that, can you also touch on like the patient's follow-up diagnostic imaging like, after an abnormal result, specifically when that has happened on, like the mobile van?
Sure. So we rather happily, we get the results extremely quick. So if they do have an normal or abnormal, we get the results next day. Some of them are even same day, which is awesome. Once we have that result and it is abnormal, we have restructured slightly. I am not a medical assistant or a nurse. However, because we have made the screenings a standing order, anyone can order them. And also, because it's a standing order, the medical director has allowed for me to follow up on those for the diagnostic. A lot of it is because Methodist does also call for abnormal results to notify the patient and let them know that I am going to call and help them schedule, or Methodist will schedule and let me know what happens next. It becomes especially important because we serve a rather large population that is unhoused, and they can be more difficult to get a hold of, which then it does turn to me to work with our staff to connect with those patients, figure out their transportation, and make sure they understand why this is important, because they have a lot of other barriers. And telling them, well, thank you so much for doing the mobile. I know that was a little difficult, but we also need you to come back. That conversation can go either way. But when we are able to make that connection, we're able to get them scheduled and help them figure out how to get to their appointments, and it becomes a little smoother. A lot of times it helps quite a bit for them to reconnect with the person, myself, who got them started in the first place.
Heather, did you have anything to add to that as well, out of curiosity, when it comes to like specific abnormal results from the mobile van?
So for here, me and another provider handle those. So U of M will send them to me. They send all the results to me, and then me and one of the providers go over all those. I reach out to the patients, and then we help them get set up to where a local facility is to get a follow-up mammogram, ultrasound, biopsy, that kind of stuff. And if it's something where they're nervous about going to do, I usually go with them and take them if need be. Oh yeah.
That's so kind. Oh my gosh, that's so nice. Like, and so just to continue the conversation on making things easier for individuals, and there's also a lot of organizations out there that can help. Oops, sorry, I just like hit my laptop. That can help this transition smoothly, get word out there. So I'd love to talk about the power of partnerships. Stephanie, you when we first started chatting it up, you mentioned that you worked with an organization called Every Woman Matters, and so I know that you've mentioned that it's really unlocked some real access for your patients. So how did that partnership come together, and what can you tell other FQHCs or clinics trying to build similar relationships with state or community-based programs?
Absolutely. So, Every Woman Matters is a program through Nebraska DHHS. And it covers the entire state of Nebraska. They reach out to every hospital, every clinic, every health center to let them know what that program is. I am not sure on the specifics of how many actually use it, but from what I understand, it's not as many as they should. For our center, it was it was very important to make that connection because of the population we serve. We know that while a lot of them do have Medicaid or Medicare, or some have the private insurance, a lot of them do not. And that's what Every Woman Matters is for. It covers cancer screenings and well woman visits for patients who do not have insurance and are of a certain income level. It's not exactly the same as, say, SNAP. So it gives a lot more leeway to cover a lot more folks. It's also really great because even though it's called Every Woman Matters, it also covers colonoscopies for even male patients or male or female patients who have bloody stool or have previously had polyps or anything like that. So we're able to work with them very specifically and very intentionally for the benefit of our patients. From what I understand, we're the only state with specifically Every Woman Matters. But from what I've also seen, there are programs across the country that are able to do pretty much the same things. So it's really important to do that research and find out who has that funding, who has programs like that that can cover those who otherwise wouldn't be covered in the first place.
Yeah, I that additional research on funding on finding funding, right, for these things, and I saw Paul, I saw you nodding a lot to what Stephanie was saying, and I'd love to hear more about like the partnerships that you've gotten, with community-based organizations and being able to provide breast and cervical screenings.
Yeah, so there's something similar in Indiana called the BCCP program. That sounds quite similar to what you've got there. What I would say is a lot of these specialty programs, they take a lot of extra work. They take a lot of extra paperwork. And so some providers participate and some don't. And it's really important for folks serving the community to really try to take advantage of every one of those opportunities if we can lower barriers for folks, even if it takes some extra work. But from our end, because like we don't have mammography in-house, we have to rely on partnerships with our local hospitals. And when we have to do follow-up procedures, that's often referred there. And so we've worked very hard at getting good relationships with our local community hospital, Goshen Health, and then Beacon Health System here also locally, so that we can do those smooth handoffs for patients. Because it ends up being very counterproductive if they've had a great experience with us and then that handoff is just terrible. And there's surprise bills and they're not getting treated respectfully. So we worked really hard to make sure that those are smooth, and grateful for those partnerships because we can't do everything in-house, right? We've got to kind of do what we do well and then have good enough relationships that we can make sure that we can do those handoffs and care to them and back from them as well as we can.
Yeah, and Heather, same question for you. What partnerships? I know you obviously work with the hospital for specifically the mobile van, but what other partnerships have been most helpful to you?
So
Um,
we have a system just like Stephanie, the BC3NP program that we use here in Michigan for a lot of our patients that don't have insurance to help cover those cancer screening testing. And then we also work with one of our local hospitals for patients for like billing for payments, and also if they can do a cash payment, they give them a discount to help cover some of those costs as well. And then help as far as like if I can't make it for some reason, they'll help designate one person to come out and make sure that the patient gets back to where they need to get. So that's been huge for us.
Yeah, a lot of what you're mentioning is just so human, right? It's refreshing to hear that there's organizations like the three of you on this panel right now that continue to provide that human nature to folks, and I think it's something that's been missing. We spoke about it in other sessions, like the lack of community and push and drive to get people where they need to be. So I'm interested in hearing any other solutions that you may have beyond the mobile mammogram ban, and any other things that your teams have leaned into. So I can start again with you, Heather.
So one thing that we've leaned into for cervical cancer screening is we have a lot of patients that won't get the screenings done because they don't want, the actual full-on Pap done, and they just don't feel comfortable with that. So one thing we've been doing is they get to test themselves. It's an in-clinic test where they get to test. They have a swab and they test for HPV, and we send that out, and that is good for 2 to 3 years depending on the results. So that's also helped with cervical cancer screening because we have those patients that just won't do it at all because they don't want to have the Pap. So we have partnered with a company, Quest, to help with that as well for our patients. Besides getting just the mammogram stuff done, the Paps are important too.
I'm so glad you mentioned that. Me and the clinical program manager, Tiana, we were actually talking about the self-swabbing and how it's becoming more and more popular. So I'm actually really glad and excited that you mentioned that. And I'm definitely going to be adding that as like a resource for folks, attending this call to, learn more about or connect with you on learning more about it. Because yeah, it's definitely something that's been on the rise more, which is really cool. So Stephanie, I'm going to ask you the same question, like beyond the van, right? What other outside of the box solutions has your team leaned into?
We've had previously a very traditional model of care, the 15-minute visits, the 30-minute well woman exams, but we have more recently shifted to relying on the MAs that room the patients and have a little more time to get those screening reminders out of the way before the provider even hits the room. That way it's not unless there's a lot of hesitancy or a more immediate need for additional education, the MA is able to get those scheduled to talk about what it's for, what it entails, to help them kind of get a better understanding of how to move forward. That has really helped quite a bit because then it doesn't put the burden on the providers, which have a little bit of pushback because of the length of time they really have at each of those visits. They can't address every reminder. So making sure that we have that initial conversation, like as soon as they're in the room, you get your blood pressure. Oh, by the way, you're due for XYZ. Let's get that managed. So starting there, that allows us to move forward in a more efficient way. We've also, once we instituted Care Message, we have been able to reach a lot more people in a way that is much more responsive than me sitting here making 100 calls a day. Not actually 100, but making all of these calls every day, giving us another avenue to make those connections and get those appointments scheduled. So it really does end up being a group effort.
Paul, has your team led into other outside of the box solutions by any chance?
I mean, so the funny thing about a lot of these is like, how outside the box are they really? Like, probably the thing we've leaned on the most is the most simple, which is we need to get all our patients in recurrently for preventive visits. And if we're doing that well, we've got a platform to build on, and we have a relationship, we have trust. And so one of the things we lead this data on is the percent of our patients who we see every year who are coming back in recurrently for those preventive visits. And it's like 80-some% are coming in, which is fantastic, because then you've got the opportunity to do these other things. And so if you've got that, then like the piece we've added onto that, like I was saying, is this ability to convert even what was just a regular short preventive visit into, okay, let's do the Pap, let's set up that referral for a mammogram, let's do that right here while you're with us, let's take care of it. And so that gives you that opportunity to kind of strike while the iron's hot. If there is interest, if they want to do it, like, let's not put up another barrier there. And then the other thing I would say is with care message, two of the pieces there that have proven really helpful. One is that outreach piece. I guess three things. Just the outreach, the recurring ones. The other one is the reminders, and the way that those are getting done has reduced our no-shows. And again, just the basic idea, if they're no-showing, they're not getting any of this done. So really trying to get that no-show rate down. And those are all around 10% for our clinics, including our mental health ones. But then finally, having the recurrent surveys that are real time, that we're finding out what's working for the patients, what's not, what are they frustrated with? Because these things that are preventive, like if they're a little bit uncomfortable, maybe there's some social stigma, and they're preventive, those are the easiest things to say no to. And so if anything else is going wrong, those are going to be the first things that get hit. And so if we want to get something like our rate of PAPs up, like, we've got to be doing all the other upstream stuff correctly so that they're willing to take that leap, to have that trust to do that. And so we really want to pay a lot of attention to their trust and communication, how safe they feel in our space, how accessible are our hours. All those pieces play into, are they going to show up, and then are they going to follow through on these things that it's really easy to say no to.
A lot of the things you're mentioning was actually said in our first session earlier this morning. Like understanding people on a cultural level, defeating implicit bias, like everything you're mentioning too. Like he actually had mentioned it. So full circle, right? Obviously, there's central themes of the day, and everyone here is on the same page. So I'm really glad to hear it. My last question or actually I have two. Automated outreach has reshaped what's possible, right? And so how has it changed where your medical assistants and navigators spend their energy day to day? I think you already, some of you already touched on it already, but if we can further expand that, and I will start with Heather.
So for me, because I'm the only one that does care message here, for me, it has freed up a lot of time, like Stephanie and Paul has said, because like I was doing phone call after phone call after phone call after phone call. And lots of times I was just getting voicemails. And I've been able to use that care message as a text system to take me from not spending hours calling somebody to just texting them and communicating back and forth on that, so that I can do other things. It's been nice too, because for example, like mammograms and cervical cancer are all female things. So like I can filter and text all my females, and it goes at a certain age. So like for my mobile mammogram, instead of calling all these ladies that are due, I can just filter it to have them go to those ladies, and then I just get text back and forth. So it saves a huge amount of time for us and stress.
I love to hear that. And I know, Stephanie, you're the main player with the platform too. I remember us talking. So if you want to also add into like how it's changed your day and where you spend your energy.
It is phenomenal, honestly. We have, for example, our list for last year, we go by UDS measures. So our list for last year was, I think it was like 1,500 patients, and which amounts, even just this year alone, it's about 300 patients per month that are due just for their cervical screenings. So being able to send out a 300 patient list by text message saves me all of the time. Because otherwise, it literally, just like Heather, it literally is me sitting on a phone all day long. And it's been massively helpful. When I started in this position, my manager started the conversation on what this role was by saying, "You're going to be making a lot of calls." I was like, "Oh, okay." And that's where it started until someone said something about care message that we weren't really utilizing. I was like, this seems wrong. So so I talked to management. I said, we need to start using this heavily. Like, why aren't we using this service? And was able to get everyone on board and start that process and use it regularly. So much so that now all of our medical staff have started using it for other outreach calls, or other outreach messages. So it's been an enormous time saver for our whole staff.
I'm so glad that it's working out for you. How has automated outreach reshaped what's possible for you as well?
Well, we would not have been able to grow at the pace that we have. So we've, in the last 3 years-ish, we have basically doubled the number of patients we're taking care of. And we would not have been able to do that while sustaining high quality scores. Like, we just didn't have the money to have the staffing up. And so we were able to basically keep the same level of staff doing outreach, but now it's twice as many patients, and being able to do that in a way that the patients feel good about and works for them. So I think there's just a huge ability to, I mean, dollars are scarce, reimbursement rates are not keeping up with pay increases that are needed to keep staff. So like, we've got to find ways to be more efficient and to improve quality. And so this has been a really, really powerful way to do it.
Thank you. Yeah, I think you mentioned before you went from 6 to 12,000 patients, right? With that, with keeping the same amount of staff. Wow, amazing work. I'm just gonna do a little clap for y'all because that's amazing.
Same amount of outreach staff. So like, the other staff have increased. So like, it's not like the providers are seeing twice as many people. So just to be clear.
That's fair. Sorry, my bad. Last question for you all. What advice do you have for folks watching right now that if they can only change one thing about their workflow, how can they start moving towards a higher screening rate? And I will start with you, Heather.
Care message is huge. And also I know that there's a lot of patients, but try to know those patients that you're dealing with. And when you're talking to them on the phone, like, smile, be comfortable in like their safe zone, and then they'll grasp towards you and trust you to get that stuff done.
I appreciate that. Same question for you, Paul. One piece of advice.
Yeah, no, I think if I had one piece, it would be to try to embed radical empathy in your organization for how people are seeing patients and these kind of programs. Like, we get so kind of numb to it. It's a performance metric, it's a quality measure, it's just something that's part of our day. But like, these are big deals for the people who are getting them. And like, all of us in our lives are occasionally a non-compliant patient and all the other fun language that gets thrown around. Like, to have empathy for the folks who we're caring for, all the way up and down the organization. And I think if we start from that kind of listening perspective, where we're trying to understand what those barriers are and then meet folks where they're at, we're going to get a lot further than if we're trying to find like a technical fix to the issue, because it's really like a human relationship challenge as much as it is a technical one.
Did you read that book by Terry Gibbons? Is that where you said radical empathy from?
No, but I should, I guess.
I literally just bought that book like 2 weeks ago. So I was like, wait, did you read that? Okay, I will send you the link to it because it just matched in my head. I was like, no way. Stephanie, any last pieces of advice to help workflows starting Monday morning?
I would encourage it to be a group effort. It is very important for you to have a person to lead that outreach effort, but meeting them when they're here, when they're in clinic and seeing and like literally in your face and making that the start of the process, have taught me making sure the providers happen to mention that they're due for a screening, just to put the bug in their ear, having the supporting medical staff address those while they're present, gives allows the process to feel more integrated. It has to be a group effort. Otherwise, it falls on one person or a very small group of people to handle 5,000 patients in a year, which is utterly impossible. So, spreading that work out is a better option than relying on a small group.
Heard you loud and clear on that, Stephanie.
Who else is on this call?
Heather, Stephanie, I thank you so much for joining this conversation, especially in this important topic of women's health. Like, you have no idea how much your presence means to all of us. For anyone who wants to connect, please let us know. More than happy to provide some info. But again, I thank you three so much. And we're going to actually head on to the stage on the left-hand side to meet Cecilia with some closing words. But I appreciate you all for being here, and I will see you shortly. Thank you, everyone.